Hello and welcome to day 6. So one of the things that we're talking about today is the mediastinum. That is the space, it's in the center of the chest and it's located between the lungs. It goes from the sternum to the spine and it contains many vital organs and structures. It's also divided into different sections for medical reference. So here are the divisions of the mediastinum. The key structures found in the mediastinum include the heart, the esophagus, trachea, thymus gland, major blood vessels like the aorta and vena cava, lymph nodes, and nerves. These structures are grouped into the superior mediastinum, you see that up here, and the inferior mediastinum. So superior's up top, inferior's on the bottom. The inferior also contains the anterior, the middle, and the posterior. So you see here the superior doesn't contain as much as the inferior. Common medical terms related to the mediastinum are mediastinal, which is relating to the mediastinum, mediastinitis, inflammation of the mediastinum, cardiomediastinal, involving the heart and mediastinum, thoracic, relating to the chest, retrosternal, behind the sternum. So understanding these terms can help coders identify the correct body system to get the correct codes. We also have the diaphragm that's typically included with the mediastinum. The diaphragm is a dome-shaped muscle and it separates the chest cavity from the abdominal cavity. It plays a major role in breathing, and it contracts to allow lungs to expand and relaxes to push air out of lungs. So contracts, the air goes in the lungs, relax, it goes out. Here's a image of the diaphragm. You see it right here. This is a pink thing. It's made of skeletal muscle. It attaches to the ribs, spine, and sternum. It has openings for the esophagus, the aorta, inferior vena cava, and it works with lungs and chest muscles during respiration. So it helps with respirations. Terminology associated with the diaphragm are diaphragmatic, which means relating to the diaphragm. You hear hiatal hernia. That's when the stomach pushes up through the diaphragm. Phrenic nerve, that controls diaphragm movement. Respiration, that's the breathing process. And thoraco-abdominal, which involves the chest and the abdomen. Coding tips for the mediastinum and diaphragm. Always identify the anatomical location in the documentation. So where is it located? Look for your keywords. Are you looking for the mediastinum? Thoracic can also be in there, or diaphragm, diaphragmatic. Match procedures to the correct body system section in CPT. Use documentation to confirm. Remember to know the difference between diagnostic and procedural. Remember, diagnostic is going in to determine what's wrong. Procedural is actually going in and treating the problem. Imaging versus surgical. Of course, imaging just going in, that's kind of like diagnostic, just going in to take a picture to see what's going on. Surgical is when like an imaging type process is used to have surgery on the body. Accurate anatomy knowledge helps to support accurate code selection. Have a great day 6.